I'm Matt Baird with the Stebbin Hawkins Clinic of the Carolinas, and my wife Sarah and I are going to be leading a trip to Haiti in March. And so those of you who are traveling with, this is meant for you as a bit of an instructional video on taking vital signs and initially assessing patients for our medical clinic that we'll be having there. We're excited to go with you, look forward to the opportunity to meet everybody, and we're sorry that we can't be with you for this initial phase of your program. But I'm going to briefly go through taking temperature, pulse, and blood pressure. Very straightforward. Many of you all may have these skills already, so I apologize for any redundant information. But to start, all of you have taken a temperature in the past. We will probably not have an automatic or an electric thermometer with us, but we will have a digital. So as you've done your entire life and as was done to you as a child, you take the probe, you place it underneath the tongue of your patient, you have them close their lips completely around it and hold it until the thermometer beeps. And that indicates that your temperature is complete, and then you record it on the index card provided. So any questions about that, feel free to let us know prior to the trip. Next is taking a pulse. Obviously, a pulse is the number of heartbeats in 1 minute, so 60 seconds. The way I recommend doing it is to feel the radial pulse, so the pulse on the patient's wrist. It is on when they're holding it to you with their palm up. It's on the outside of their wrist, just inside of the tendon, on the lateral most side of their wrist. So you're feeling right over the pulse, and you want to count the heartbeats that you feel in 10 seconds, and then stop and multiply by 6. Obviously you can do it in 15 seconds and multiply by 4, but I find that the 10-second pulse count is relatively accurate. So count for 10 seconds, multiply by 6, and then write that down on the index card provided. Finally is the blood pressure. Blood pressure is a little bit more complicated, but again, you all are all smart Swanee students, and I have no doubt that you're going to be able to pick this up without any problem. So you choose one arm. It usually does not matter which one. You wrap the blood pressure cuff around the upper arm with the mark that says artery on the front, like so. You have the patient relax their arm completely, and you take your second tool, which is your stethoscope, and you place it right in the crease of their elbow. It's called the antecubital fossa. You tighten the bolt on the blood pressure cuff and pump the blood pressure cuff up until it surpasses 200. You then gradually release the pressure with the valve, letting the needle gradually fall from 200 down, and you listen for the initial thump, which will sound like a heartbeat. After you hear the initial thump, you continue to gradually let the needle fall until the pulsations go away, or you no longer hear the heartbeat. The way you record the blood pressure is the systolic blood pressure, the number on the top, is the number at which you heard the first thump. The number on the bottom, which is the diastolic blood pressure, is the number at which the heartbeat went away. And that's how you record it on the paper, the systolic over the diastolic. If you have questions about that, review this film again, and obviously Sarah and I are happy to answer any questions about that. For every patient that we see, we'll be doing these 3 vital signs. So this is a critical part of our triage process and initially evaluating our patients in Haiti, as we do in the States. So we look forward to joining you, and if you have any questions, please let us know either by email or phone.